Hi friends, my name is Mia. Have you heard of a condition named Ehlers-Danlos syndrome? Well, if you haven't, let me tell you, I have seen quite a number of clients with this condition and a few friends, in fact. It's hypermobility. It's stretching and strength, finding the balance between the two to support your body. Many people think flexibility is a good thing, but too much of a good thing cannot always be a good thing. Individuals with EDS or generalized joint hypermobility, which I do not have, is often a challenge, and it's not a lack of flexibility that is the issue, it's having too much. It's a group of inherited connective tissue disorders that affect collagen, which is one of our body's most important structural proteins. Collagen provides strength and support to ligaments, tendons, skin, blood vessels, and other tissues throughout our body. But when that collagen is altered, joints can become excessively mobile, leading to hypermobility. This means that joints can move far beyond the normal range of movement that we would expect as exercise scientists in a particular joint. While this may appear advantageous for sports like acrobatics, circus, gymnastics, dance, yoga, excessive mobility can often come at a cost. Sometimes they can experience joint instability, recurrent sprains, subluxations, dislocations, muscular fatigue, postural when the posture is not aligned, chronic pain, poor proprioception, and reduced physical confidence. One of my clients used to always pop out her hip joint every time she reached down to do the dishes. The dishwasher was down below. We had to have that altered. One of the most misunderstood aspects of hypermobility is stretching. People with EDS are frequently told they are tight because they are experiencing muscle tension, aching muscles, and feelings of stiffness. However, what they often experience is not true muscular shortness. Instead, the muscles may be working overtime to actually stabilize these joints that lack adequate ligamentous support. The body is incredibly intelligent. Let me tell you that. When ligaments and connective tissue are unable to provide sufficient stability, muscles attempt to compensate. These muscles may feel tight, sore, or overworked because they're acting as the body's natural brace. This creates an important clinical consideration. Stretching can be beneficial when it targets the specific muscles that have become genuinely shortened or overactive. Gentle mobility exercises may also help reduce discomfort and improve movement confidence. However, excessive stretching or already hypermobile joints may worsen instability. For someone with EDS, the goal is not necessarily to achieve more flexibility. The goal is often to achieve more control. This is where my secret of strength training is essential. It helps to create what clinicians often describe as active stability. Unlike ligaments, which prove passive stability, muscles can actively support and protect joints during movement. When muscles become stronger and more coordinated, they are better able to control joint positions, which is vital and what we want. It reduces the excessive movement and absorbs forces that would otherwise stress connective tissues. We see in research that it demonstrates that appropriately prescribed strengthening programs can improve pain, physical function, balance, confidence, and quality of life in people, especially with these hypermobility disorders. Strength training also improves proprioception, which means where your body is in space and time, knowing that sense, that ability. Many people with EDS have reduced proprioceptive awareness, which can increase the risk of injury and contribute to the feelings of instability. Strength-based exercises help retrain the nervous system to better recognize and control that joint position. Strength is very important for hypermobility and is often different from traditional fitness programs. This is when you would typically have a personalized program set for you. The focus is on joint control, movement quality, core stability, postural endurance, and correct gait, balance and coordination, gradual resistance progression, and functional movement patterns. So rather than lifting the heaviest object, the objective is often to improve control through a safe and comfortable range of motion. For many people with EDS, and one of my best friends have it, the ideal exercise prescription is often mobility and strength. So gentle stretching can help relieve the muscle from that tension and improve the comfort. But strength training really provides them the stability that they need to support the hypermobile joints. So together as a combination balance approach, it's a useful way of thinking, because if flexibility is the size of the playground, strength is the fence around it. Without a fence, movement can become difficult to control. It also gives you more freedom with the strength, coordination, and stability. They can, with EDS, you can typically feel more confident and comfortable. The aim is not to stop moving, and the aim is to move well. Exercise is not simply about fitness for people experiencing EDS. It's about building resilience, protecting joints, improving function, reducing pain, and ultimately enhancing quality of life. The strongest joints are not necessarily the least flexible. They're the joints that are best controlled. So, for anyone with hypermobility, strength is often the key that transforms flexibility into function. Also, really important, the mind also plays a very important role. When people do have EDS, one of the most important things is also to attain to the stresses that they feel inside their mind daily. It's really important to build up self-efficacy, self-confidence, and develop a program as an exercise physiologist and exercise scientist that develops both concurrently, strength and stretch. Thank you very much.